Hey, 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 Mom Nation, and welcome back to another episode of Mental Wealth, where we work on ourselves so that we don't have to pass it down to our kids. Basically, that's what we do here, right?
That's the gist. That's the goal.
And another thing that we do too, that I don't say in our intro often, is we talk about kids and we talk about their mental health because as moms, as women, that's kind of like all wrapped up in our lives as well. I was talking to a mom the other day. In fact, my mom always says this too. And this mom I was talking to is kind of like you. She has adult, like men for children now, and she's like, the momming doesn't stop.
No.
Like, it's different for dads, I think, but the momming doesn't stop. Like, we're still worrying, we're still checking in, we're still making sure that they're good to go and they have everything they need and they're, wonderful enhancements to society. And so I feel like it's important to talk about kids at all these levels, whether they be little kids or, middle-aged kids, if that's a thing, tweens like mine, teens, and young adults like yours. I feel like it's important because it definitely comes into the fold of our own mental health, I feel like.
It totally does. It can be draining. Like, I was thinking about self-care today and just like prioritizing yourself as a mom and like, what does that even mean? And how does that work? And what does that look like? And I just sometimes get overwhelmed by it all, like all the needs of the kids. And my kids, like you said, are adults now, minus one. I have one minor. He turns 18 in like a month.
Oh my goodness. Crazy.
I almost did it. I'm so close.
Nearly there. Close. By next episode, you're going to have all adults.
That's crazy to think about, but yeah, like, but it's still overwhelming sometimes. It's still like, okay, I have to text everybody, like, where are you? What, is anybody coming home for dinner? Like, does everybody have food? What, I text about the groceries, like I'm ordering, because I do Instacart. I'm ordering groceries. Does anybody want anything? Like what? And then they all text me their grocery orders. And I don't know. It's just a lot.
It is a lot. And I don't know. I'll have to talk to some older dads. I guess I really don't have conversations with dads very much. I'm more kind of mom oriented, but I'm going to talk with some older dads and see if they're like, hell no, once they're gone kind of thing. You know what I mean? Or if they're still like us. I don't think my dad is. My dad doesn't really worry about me a whole lot. We connect, but it's because I connect with him. I worry about him more than he worries about me.
I feel like that's what happens. The older you get, right? Then you start thinking about your parents and the reverse happens.
Yeah. And that's a whole episode that I think we really need to have. Maybe I should write that down right now.
That would be a good one.
Because isn't that an interesting dynamic? I was talking with another mom the other day, and she was like, it's weird to me. She's helping her parents move here. They're going to snowbird here. So they're a little older. Okay. And she's like, it's hard to share my wisdom with my parents because they still think they know more than me. And, because she's talking to them about different areas to live in and what it's like here and everything. And it's just a strange sort of kind of uncomfortable conversation is what she was sharing to have, because she's like, you still want to be there. You're still their child, but we grow beyond them at some point. Right.
Yeah.
And then how does that make them feel? I wonder.
I know. And then you're just like peers. You're kind of like, your relationship dynamic totally changes.
And I'm starting to feel like, not so much my mom, but I'm starting to feel like I'm getting there with my dad now, where I'm like, no, bro, it's not like that anymore. This is, 2025, not 1995.
Yeah, things change. Things just a little different now.
Just a little bit different. But man, 1995, I just brought myself back. Let's hop into the topic of today. It is about kiddos, and we'll put it up on the screen. We are talking about a post that came out in the Mom Nation Arizona group. Oh, May 19th, 10 days ago. I was thinking it was a little bit earlier than that, but I don't know. May's going by so quick. It's ridiculous.
Yeah.
So this came out, and it stuck out to me because when I was a child, I had this problem. Like, I felt like this was happening to me. So I could totally relate. when she put this out there. And I was really interested in seeing what comments that she got, because I'm kind of coming from the child perspective on this. I haven't really dealt with this with my 11-year-old yet.
Mm-hmm.
And so then I got really excited to talk with you about it and see kind of what your take is. But for those of you that are just listening, I will read it. If your kids have or had intrusive thoughts, what age did they start? My 5-year-old daughter is having them about our house being on fire every single night, crying and worrying.
Mm-hmm.
Totally, like I can totally picture myself in this 5-year-old's body having these fears, because I had a lot of these fears, like I mentioned myself, this is being one of them. This exact thing was one of them. Yeah. So when you read it, as you know, doing what you do, knowing what you know, working with kids a lot, what's the first thing that comes to mind for you?
I think about the kids' mindset like throughout the rest of their experience, right? So either they are going through like stress or like a transition, maybe like intrusive thoughts are a really common brain thing that we do. Our brains kind of get stuck on these loops, especially at that age, like that 5-year-old age. I'm thinking about normal brain development. And that's when at 5, we are just in like the beginning of having our left brain kind of come online and our thoughts brain get started going. And prior to like the age of like 3, 4. So I'm thinking a 5-year-old is like not necessarily out of this developmental stage yet, but like 3 or 4, our left brain comes online. And that's when we start having like that's when we start acting and thinking more cognitively versus, our emotional brain is kind of the first part of our brain that starts to develop. So when our right brain starts to develop or starts to act, that's what we're using as when we're born. We're using our right brain. We're using our limbic system, like our lower, like hind brain, kind of our lower brain, like close to our brainstem. We're using our limbic system. And then we're using a lot of our right side brain. That's where like creativity, colors, shapes, like abstract, like things kind of come in. And then our left brain comes online, and that's when we start to use like our cognitive, like that's when we start to learn to read. That's when we start to learn to write. That's when we start to learn to, count numbers and things like that. So that's when we start using that side of our brain. And then what happens is they need to start connecting. They need to start connecting to each other and making sense of things and making sense of the world around them. And so I'm thinking, okay, maybe this kid's brain is stuck in this thought loop because some abstract thing happened on one side. Maybe they saw on TV, or a friend told them about a fire, or maybe they learned from a firefighter at school. Like maybe they had, like a fire drill or something like that. And so this information comes in, and then their right brain is like emotional, like, oh, well, this could happen to me. I'm so scared. I get, fire feels scary. Fire makes me worry. Fire makes me cry. So like I have all this stuff going on. And then my left brain is like, no, it needs to make sense. Like it, let me have these thoughts about it. So I'm putting thoughts together, and then I get stuck in this thought loop, because it's just your brain's kind of gearing up. Like you're just learning how to use your brain together. And so it sort of feels like it just is. Sometimes it's just normal brain development that kind of gets stuck in a little bit of a glitch, like a skipping on the CD almost, mm-hmm. It's doing its thing, and it's supposed to be doing its thing. It just kind of got stuck a little bit.
That was a great explanation, and I really appreciate that. As you were talking, I was thinking to myself, that's the age, and maybe it's different now for kids. In fact, when I had my son, he was about that age. The stories were a little different. But remember back when we were kids, what kind of stories were we reading? Humpty Dumpty fell off the wall. Hansel and Gretel, the kids got cooked, or were in danger of getting cooked by a witch. Like, what the heck?
Well, in like every single kids movie, like the parents die within the first like 5 minutes, right?
Yeah.
So, yeah, there's a lot of stuff that could be scary.
That wasn't helpful.
No, it's not that helpful. And then what happens when you go to school? You have a fire drill. The fire department maybe comes, you get to check out the fire truck, and then you start thinking, oh, what's a fire, right? Like, I don't even know what that, and then it's like, now I know what that is. and then they talk about fire danger or fire safety, and then your brain just like clicks it all together and then just gets stuck.
Yeah. And these days, unfortunately, but I'm grateful they do it, they're doing other drills these days that we weren't doing back then. So we've always had fire drills, remember, but we've never had active shooting or lockdown drills.
No, but I've had clients come in, and I've worked through the trauma of a drill with a kid who started feeling afraid to go to school after they had a active shooter drill, because during the drill, like, they didn't know that it was a drill.
Oof.
And so they were just scared, and the teacher wasn't very nurturing about it. And it was just like this bad scenario of, this kid feeling alone and scared, like she's in an active shooter situation. And that trauma, like, her limbic system doesn't know that it's a drill. Right. And sometimes when we're so overwhelmed with fear, that orienting response doesn't come back up for us very quickly. Like, an orienting response is, when my friend used this example today when I was talking to her, like a deer who's like grazing or whatever, and then hears a twig break and then pops their head up, looks around, and then they go back to grazing, right? So that looking up and kind of looking around, like checking things out, like, oh, do I see a mountain lion? No mountain lion. Okay, let me go back, right? But if the perceived threat is too big, is too overwhelming, and it floods the nervous system with fear, and then you have a traumatic response, which is that the orienting response doesn't click back on. So you don't come back from that and say, like, oh, everything's fine now. I don't have to worry. I don't have to be afraid, right? So that orienting response sometimes doesn't like tell us that everything is safe again, because we were too flooded in that moment with fear and concern.
Yeah. And that's got to cause stress. And then that stress probably causes more of those thoughts, and it just kind of feeds itself. Seems like.
It feeds itself. And that's what sometimes happens with like OCD. A lot of times intrusive thoughts are like a symptom of OCD, which I'm not saying that this kid has OCD or that like that should be a concern or anything. I'm just saying that, like, we think of OCD as like repetitive, like, movements or checking like the locks or needing things to be in a certain order. But those are the compulsive nature of the OCD. But there's also the obsessive part of the OCD that is thoughts. And like, so sometimes like the thoughts will come in and they'll feel like they can't be stopped, but we can use regular coping skills for those. And, for a kid who's having intrusive thoughts, like, we can handle that in an effective way by staying calm and having the kid kind of share, like, what are you thinking? Like, what's, I might just ask, like, where did you learn about these thoughts? Like, or, what, and then if they don't know, then say, okay, no big deal. Like, I wonder if you can notice how safe we are right now. Like, check, did you know that we have fire alarms just in case something happens? Or, like, recognizing those points of safety and like reprogramming that orienting response to say, like, hey, when we have these scary thoughts, that's okay. That's just our brain kind of trying to work stuff out. But let's take a minute and notice the safety around us. Let's notice that our windows, are closed and safe, and that our fire alarms work. And you can even test it with the beep. And, we can notice that we know the number to call if something happens, and the fire department is right down the street, and, all the different things. Like, kind of walking through the sense of safety could be helpful, but not in a way to like prove the thoughts wrong, but just in a way to like acknowledge the thoughts and attend to them. Right. So like, that's us doing our head popped up. Now we're looking around. Right. So like, okay, let's do the look around. Like, let's check, make sure everything's okay. And then once everything's okay, we can come back to that settled state where we can eat, we can sleep, we can, do all the normal everyday things that we need to do. And those are things that we need to do to have like a fun life. The thoughts don't have to interfere. We can attend to them and then come back.
Mm-hmm. You know, I like what you said about it could be something, this isn't exactly what you said, but it's the idea, could have been something simple that, you know, created this thought, something, for example, when I used to have the thoughts when I was a kid, I remember going to the grocery store with my grandmother, and there was like the National Enquirer or whatever, like those tabloids, you know, that are right at the little kiosk or the end cap while you're checking out. And of course, she used to have this big old cart of groceries, so I had plenty of time to read the headlines. And when I could read, it was all about aliens back then, and like alien sightings, and aliens are coming in to steal children and stuff. Laura, I didn't sleep for a week, and I probably peed the bed once at least.
Yeah.
With thinking aliens are going to come down and steal me out of my window.
Mm-hmm. Yeah, we just little stuff gets in our head. When we're little kids, it's content without context, right? We've talked about this a little bit before, like decontextualized content, like aliens are going to snatch you out of bed at night. Like, okay, that's really scary. But if you're an adult and you have like a big picture context for that, and you're like, well, that might not actually be a thing that's happening. You know, this news source might not be the right news source to listen to, or this or that, or whatever. There's so many ways that we as adults might make that make sense. Whereas a kid is just like, oh my gosh, this is in the news.
Yeah.
This is happening.
I was so scared. I remember being so scared, like every little noise, and we lived in the woods. So there's lots of noises, you know, every little noise, everything. I was just crazy scared about aliens coming to abduct me.
Yeah.
And then that whole movie comes out, Fire in the Sky. That didn't help me out.
Yeah, that doesn't help at all. And, you know, when we're little, sometimes we need to replay stuff to make it make sense. So like, you know how kids will tell the same story over and over and over?
Yes.
So we want to let them tell that story over and over and over. And we want to kind of let them just be like, oh, and then what happened? And then what happened? And then what happened? And then notice that you're safe now, and notice that it's over. And then the people came and it was better. And, you know, like, let's say it was a fire drill or something, like it was really scary. And then the firemen came, and then, you know, I knew that they had their hoses and the truck that could help us. And there was safe adults that could come and help us when we needed it. And that everybody got to go back into their classrooms and everything was okay. Like, you know, even if it's not a drill and it's an actual emergency, like that's how you process trauma in real time. Is that's how it doesn't get stuck, is like you talk it through and let it out and let it like play itself out and be like, oh, I was really scared. Yeah, you were really scared. You know, you were really scared when the fire alarm went off. You were really afraid that something bad would happen. You said you were afraid that, you know, maybe you were afraid mom and dad wouldn't know where you were to come and find you. I don't know, whatever, right? Like,
yeah, lots of things
that you could be afraid of. So kind of validating that fear and saying like, yeah, you were really scared. And then what happened? Well, and then, you know, they came in and said that we had to go out and walk by the playground. Okay. And then what happened? You know, and then I was feeling a little bit better by the playground because I saw the fire truck. Oh, and then you saw the fire truck and then you felt better, right? So you're like mirroring back like what's going on with this little kid's brain, and they're processing through it. And then you're with them. So you're attuning to them. Like the relationship is one of the healing factors. The fact that they're not just sitting there alone in their thoughts is actually part of the way that they heal, is for us to connect, and then we walk them through. And then we come out on the other side together and connected and attuned. And we make sure that they kind of bring that story all the way to the end and notice the safety at the end.
Even you saying that makes me feel better. I'm like, where was Laura when I was going through this? A couple of moms did comment on the post, and they brought up some of their own personal situations with their kids. Yeah. And a few of them actually said, you know, my son or daughter has dealt with this before. I, you know, can totally relate. And some of their examples were, one in particular just had my heart. She was very concerned because her son was having thoughts about harming his siblings. And then she said, you know, we spoke to our counselor about it, and the counselor said it's not that, like, he's not planning to act on that. Right. But can you dive into that a little bit? Because that, for a parent, I mean, I get the goosebumps all over. That's going to be really alarming. And I know this woman, and she had at the time, she has young kids, and the son is the oldest, and so she had babies.
Yeah.
That are very vulnerable,
Yeah. I think that's so scary when we hear our kids talking about harming themselves or talking about harming someone else, like, or even having thoughts of that. But we have to remember it's scary for the kids too. Like, those thoughts are really scary for the kids to have. Like, kids don't want to have these thoughts. Mm-hmm. They are coming out of nowhere. They're a way for our brain to process information. There's sometimes, like, I always think about, okay, what could be helpful about these thoughts? I know it doesn't sound like anything would be helpful about that, but like, let's think about it. What's adaptive about having thoughts of something bad happening? Or what if I do something bad? Maybe it's because I'm afraid that I could make a mistake and hurt them by accident, and then my brain just got carried away, right? Maybe it's that I got angry one day and then I had this thought, and then I got so ashamed of myself for having this thought. The thought kept coming back because it was like trying to, my brain was trying to say, like, that thought's bad, that thought's bad. And then what we resist persists. And so when we resist something and push it away, it often like comes back in spades. And so like sometimes when we get angry or full of rage, like we might think about hurting someone, right? But that's not a plan. That's not intent to hurt someone else. But sometimes those thoughts can pop in. And then when they do, our brain's like, oh my gosh, that's so bad. There's something really wrong with you. And then they try to resist those thoughts. And then those thoughts just keep coming back because we're trying to push them away. And so a lot of times we have to just acknowledge that they're okay and that they exist and that there's nothing bad about them and that there's nothing wrong with the person who's having them.
And would you suggest talking it out and just asking, like, I guess depending on the kid, how do you even know this is going on, first of all, right? And so do you have any recommendations on how to speak to your child, whether you suspect this might be happening with them or not, just to kind of even get a little bit closer, make your connection a little bit stronger, but to also get in their head and kind of figure out like what's going on in there, especially if you're seeing, some stress or maybe some behavior that's abnormal or maybe acting out, that kind of thing.
Yeah. I might say like, hey, sometimes when we get stressed, like our brain makes thoughts that we don't like or that don't feel like are ours. The thoughts don't feel like they belong, or they make us feel bad about what we're thinking. Does that ever happen to you? Like, I noticed it's been stressful lately. We just moved and you started a new school. And so I'm wondering like what you think, if you've ever had any thoughts that you don't like, and maybe we could talk about that. Sometimes we can just present that information like, hey, I sometimes have thoughts that are upsetting, and like, or lately I've been thinking about stuff that I don't like to think about. And I was wondering, has that ever happened to you? And just kind of like opening the door to having that conversation.
That feels like a safe conversation, right? This happens to me. So you're putting yourself out there first. That feels like a safe conversation versus like if I was a child versus, what's going on in your head kind of language.
Yeah. Yeah. It's always helpful to normalize it, to say like, I have these thoughts that I don't like and they come in my head and I can't seem to make them go away. Does that ever happen to you? And just being really curious and then saying like, did you know it's normal for this to happen? Like they can be really bothering. Sometimes I use the word bothering. Like these are bothering thoughts. And sometimes I have these bothering thoughts. Do you ever have bothering thoughts? And, it's normal to have bothering thoughts. What do you do when you get bothering thoughts? Like, I sometimes will go outside and I'll like plant in my garden, or I'll take a walk, or I'll play with the puppies, or, maybe if I'm having a bothering thought, I'll read a book, or I'll try to do something else that like play a game or play with a toy that makes me feel good. What do you do when you have bothering thoughts? Like kind of asking about that and giving some solutions and letting them know like this is a normal thing.
At what point is it not? Where's the red flag? Where is that threshold where you're like, we should probably seek help for this?
I think that's a good question. It's a hard line. Like, that's a hard question to answer definitively. Like, I think so. Whenever I'm looking for, as a clinician, I'm looking for clinically significant distress. So what does that mean? Well, it's interfering with my ability to go to school. It's interfering with my ability to have a good relationship. It's interfering with my ability to like be kind to myself. It's interfering with my ability to sleep. It's interfering and for a prolonged period of time. Like if it's going on every night for a month, right? Like 2 months, 3 months, like 3 months is a long time. Like if it's every night for like a week or 2 weeks or whatever, maybe even 3 weeks, like, I don't know, we'll see, like play it out. Right. But I kind of give it like a 60 to 90 day, like in my head, I think like a 60 to 90 day rule. The other thing is the content of the thoughts. Like if it's like, I'm having these thoughts about hurting someone and I'm really afraid I might do it, because whenever I have these thoughts, it makes me want to go get a knife from the kitchen. That seems problematic to me.
Yeah,
that
seems
escalated distress, right? So, or I have thoughts about hurting myself. Anytime we're talking about hurting ourselves or hurting someone else, I generally recommend to like talk to somebody, like see a professional, because those things, kids can be impulsive, and those thoughts are really scary to the child, right? So the child is in distress about the thoughts, and the child's thoughts can escalate into something bigger. So like if I'm having thoughts about hurting someone, if I'm having thoughts about hurting myself, you know, it's a good idea to seek counseling and take that serious. I always just take that seriously, right?
Yeah.
If it's about something outside happening that we know isn't happening, or that, you know, we know that we can take safety measures and things like that. And also there's a thing called adjustment disorder. Adjustment disorder is that when after a change, we have symptoms of distress, and I could get into like the actual symptoms. I'd have to get out my book. But there's symptoms of distress for 6 months, persisting 6 months after the change.
Okay.
So basically we kind of give that 6-month period. For like PTSD, it's like a 90-day to 6-month period of like, how do you know that this is unresolved? So that kind of time frame matters sometimes. But you can do therapy for 3 months. Therapy doesn't mean you're in therapy for the rest of your life. Therapy means like you're coming in, I've got these thoughts, I don't know what to do. 3 months of therapy could help you just swing out of that stuck loop and move forward.
Yeah. And we don't know what we don't know, right? And obviously trained professionals are trained professionals for a reason. And I know you guys have all sorts of tricks up your sleeve.
Well, we have a lot of context too. So like we ask, when I meet with a family, I meet with the parents first. And so I'm trying to understand, I mean, when I'm trying to meet with a parent and I want to understand the child's history. I want to understand, did they have trauma during their birth? I want to understand, have they had any major changes in their life? Like since then, have they ever experienced a divorce? Have they ever experienced a family member using drugs or going to jail, or in and out of the house in like an unsafe way? Have they ever been exposed to like weapons in the house in an unsafe way? Have they ever been exposed to a trauma, like a car accident, or like witnessed anything? Or someone in their life having experienced a trauma, like an injury, like a sibling experiencing a severe injury, stuff like that. Like all of this context matters. There's so much there.
One thing you brought up, which I never even thought of, this is one of the reasons I love you, is birth trauma. Like, do you mean like if they were sick, or if there was complications with the delivery, that kind of thing. Like, what can you give an example of, like, maybe a trauma and then the result of it from birth? Because that's something that I haven't talked about a lot or thought about.
Yeah. So people who experience trauma at birth, like a traumatic delivery, often have a fear of like doctors or hospitals. They don't like, so little kids, like babies might like not want to be touched or not want to be like attended to. They might get like afraid of, being like examined or whatever. If they're, they might have like a strong phobia of like shots. They might have like a bigger fear than most kids would normally. Like every kid's afraid of shots, but like a big fear. They might have like dissociative tendencies where they kind of like numb out and like don't really respond to like distress. So like if like maybe they'll have a high pain tolerance, maybe they'll have they maybe won't cry very much, and so like on like almost like abnormally not enough, like they might experience sensitivities to lights and sounds. So like I see a lot of like processing sensitivities, like lights and sounds and textures with birth trauma. Because like if you think about being, especially if they're in the NICU for a period of time, like you're poked and prodded, you're alone, like you're basically helpless and alone for a really long period of time, like in your early years, and there's bright lights, there's people coming in and out, there's lots of different people. So like maybe they might have a fear of lots of different people. I've seen that before. So there's a lot of different things that can come from the trauma at birth. And then additionally, the mother's trauma from that experience can affect the way the child and mom like relate to each other. So like mom can have a fear response to the child's distress that then like exacerbates. So like if a mom gets like really scared every time the child is in distress, then the kid will kind of have a heightened fear response and be like hypersensitive to their environment and to other things like that.
It's crazy and I know this, like, I know that babies, even in the womb, like, they can feel, they can hear, they are absorbing energy, they're absorbing, right? But it's, I don't know, just maybe something that, and maybe it's just me, I didn't think of that, like how a traumatic birth could affect them later on in life. Like, for example, I have some medical traumas. I'll give you a really small example of kind of a minor one. I used to get a lot of ear infections when I was a kid. And this one doctor put the ear thing in so he could look, but he like jammed it in there and really hurt me like bad. And I'm 46 years old. And to this day, when they go to do the ear thing, I'm like,
yeah.
I go like, do you have to do that? Because I don't really like it, kind of thing. And I've never really thought, again, maybe it's just me, that little that they would remember that.
Yeah, that's a perfect example because they don't cognitively remember, but their body remembers, right? So when we're a baby, we talked about the brain development, like we don't really have that cognitive brain online yet, but we have our senses online. So like our sensory experiences are telling us whether things are safe or dangerous. So like if things are, like our senses are designed to keep us safe, right? Like the taste, our taste of like if food is rotten or safe to eat, right?
Right.
The smell that tells us if the air is clean or the water is clean or the environment is clean. Visually we can look and see, we can feel things, like we can feel if something's sharp or hot, right? So our senses tell us whether or not our environment is safe. And so when we're a baby and we're experiencing trauma at birth, our sensory inputs are overloaded with pain, right? Like babies don't have a lot they can do about pain. So they dissociate. And so they will cry until they're not being attended to. And then if they're never going to be attended to, they just stop and they just give up. and that's a shutdown response. And so, that's not the case every single time your child stops crying without your help. But in a trauma, that's a situation where it's chronic. It's happening for a long period of time. It's happening over and over. There's a lot of fear. There's a lot of like cortisol. You're being flooded with those fear hormones, and stress hormones that are happening. Like with a baby who's being born, I had a little girl tell me one time, I was like, what do you think it was like to be born? She was like, so scary. And that's what I was expecting. I was expecting, like, this was one of the first times I ever asked this question. And I was expecting her to be like, oh, like it was fun. I got to see my mom. I got to like meet the adult, whatever. I don't know. I didn't know what I thought was going to happen, but it wasn't that. It was so scary. All the lights, like, and this person has sensitivities to lights and sounds, has a lot of like sensory processing stuff. And she just basically described how it was traumatizing to be born and like come into the world and like have this sensitivity now. And like, basically like the lights are so bright, the room is really cold. Like I was nice, and she literally like curled up. Like I was nice and warm and like in this perfect like belly that was made for me. I had everything I needed. It was exactly what I wanted. And then I'm just born, and then the world is just the world. It's like,
I feel you, sister.
Right? Like, if you think about it that way, like, well, yeah, I would so much rather be in the belly, right? So it's just interesting, the things that kids will say, first of all, and the insight that they have is hilarious and awesome. And so I just was really blown away by her story. Like she just really had this attunement to like, the world is not this place that is so like safe and warm and cozy. And that's where I was, and they took me out of it.
And she remembered?
Well, she's like, I'm basically saying like, imagine, right? Like, imagine what it was like, right? Like, so she's not saying, well, I remember feeling this way, but what she's saying is my body tells me that this is how I was feeling.
Yeah.
You know
the
what
body
I mean?
remembers.
Yeah.
Do you know if she had a traumatic birth? I mean, that sounds traumatic, but I know that's kind of a normal birth, right? The lights, the sounds, the everything.
Well, yeah. So like on a level, any birth is traumatic. I mean, it's kind of a big deal. It's a big experience. But yeah, she did have a traumatic birth.
And I can imagine, and I wonder, like, is it different for babies that aren't full term?
Probably.
Because they didn't spend their allotted amount of time in there,
Oh, sure. I mean, there can be a lot of like residual health effects too, and that can impact like a kid's experience, right? So their experiences with the medical, like their medical experiences can be really traumatic from the perspective of pain. Like if they have chronic health issues because of that, like, so then it's a little chicken or egg, right? There's kind of a little bit of everything happening. If you're born prematurely, it's very likely that you spent time in the NICU. If you spend time in the NICU, you're being separated from your family, you're being separated from your parents, especially like the NICU during COVID, for example. Or, you know what I mean? Like just thinking about the separation and what we need as a baby, like that attachment need, and then that rupture, like so early on in the experience. Sometimes when a baby is born and then the mom is in distress or sick or, has some complications, like that can be traumatic for the baby because the mom is not able to attend to the baby's needs as much as she would want to. And so when we think about our nervous system as a learning organism, why wouldn't that matter?
Yeah.
Right? Why wouldn't our brain take that information in and clock it as important and continue to believe that that's something that's a threat?
Yeah, that makes a lot of sense. Wow. I feel like we went really deep into that. Well, probably not for you, but for me, things that I haven't really thought about, that make a ton of sense.
Yeah. And so when someone comes to me, I'm getting all this context about this whole person, and it's not just about like their symptoms today. It's about everything that they've experienced. Like, are they experiencing a transition? Did they move recently? Are the parents working? Did they lose their jobs? Did they start a new job? Are they working different hours, more hours, less hours? Did they have the birth of a sibling? All these different things. Like, transitions are really hard and can cause a lot of stress and anxiety in little kids. And so that's why we say we want to be consistent all the time, because predictable and consistent is safe.
Yeah.
And so anytime something is disrupted, that kid can kind of spiral into some worry thoughts and anxiety thoughts, and that's normal. It's the content of the thoughts can vary, but most of the time it's about something bad happening to them or happening to a family member. Most of the time, that's what we see for intrusive thoughts.
Yeah. I mean, that was my thing when my brother was born. That was a whole, different ball game for me. I was 10 years old. So I had lived 10 years of life as an only child. And then my little guy comes in and he's wonderful and I loved him and I was really excited about having a baby brother. But then I started thinking all this bad stuff was going to happen to him. It really affected me. Like I still, just even thinking about like putting myself sort of back there now, my heart just kind of went, you know what I mean? Like it really affected me.
Yeah, like those thoughts are unpleasant.
Very.
They're uncomfortable, they're scary, and they're not in our control. We can't control our thoughts. We can change them after we have them, but we can't control them from the perspective of preventing them.
Yeah.
Right? Like our thoughts are just automatic reactions to environmental stimuli. They just happen. So like internal or external, they just happen. And so once we have a thought, then we can do something with that thought. We can attend to it and we can address it, or we can act on it, or we can, try to shift it into something else. We can make it malleable and mold it into a picture of a tree or something. I don't know, but we can address the thoughts and move them once we have them, but we can't control them in the first place.
Any other advice for this mom that has the 5-year-old that's worried about her house burning down or worried about dealing with a fire? I mean, we really went deep and we gave a lot of advice, but does anything else come to mind that you would like to share?
I just keep thinking she's probably already done this, but like when the little girl's having these thoughts, like kind of just validating her, like, you're really scared. I see you're really scared. I'm here with you. It's going to be okay. Let's just be here while these thoughts happen, and then we'll keep moving together. Right? We'll just keep going. We'll keep moving forward, and I'm right here. Let's let these thoughts come for 5 minutes, and then I'll let you know when 5 minutes is over, and we can think about something else, or we can check in on them again. Like a lot of times they'll pass, after a few minutes of just like connection and being worried. But like sometimes just a hug and like, I'm here with you. I know you're really scared. I'm right here can be helpful.
I love that. I love that a lot better than, oh, silly, that's not going to happen. Cut it out.
Right.
Go to bed, I love that so much more.
Yeah. It's tough though. And as a mom, like I can sitting with your kid for many minutes while they're in distress and crying and being upset. It is hard not to try to fix that.
So hard.
It's hard not to try to counteract that and say like, that won't happen. That's not, because we can't say, so like the bottom line is we can't say it won't happen. We can say we have precautions in place that we're going to be safe. Right? Like we're going to take care of you. Mom and dad have it under control. Mom and dad are going to make sure that we have a safe house and that we are taking care of everything we need to. And, but it's hard not to fix it, but sometimes that's what it takes, is to not try to fix it.
Yeah. Yeah. Well, because for me, when somebody tries to fix something and I just really need to like vent and unload and just let it play its course, feels unseen and unheard. It's like, it feels like it's just being swept under the rug or, bypassed somehow. And that doesn't feel good to me. So I could totally understand how little kid is just the same.
Yeah, exactly. Nobody wants to be told that they're wrong.
Right. I love it. Thank you again, Laura.
Sure. I
appreciate, seriously, like we always joke that this is my therapy session too. And we talk a lot about me. So I think it counts.
I think it counts. But no, I think this is great. I really am glad that we got to talk about all the things we talked about today. I know this took us in a direction. I wasn't sure where we were going to end up, but here we are. And I think, I don't know, I hope this helps this mom feel less alone, because this is normal. And this is, something that lots of kids go through, and that it's not permanent. It's temporary and it'll pass.
Yeah, I think, and this is something that I get caught up in a lot, is the normal thing. Like, is there something wrong with my child?
Mm-hmm.
Because he said XYZ, or he did this, or whatever, Yeah. So I love that you're telling this mom, this is pretty normal stuff. Like, this is stuff that I see quite often. And that helps me as a mom, just putting myself in her shoes, be less overwhelmed, feel less guilt, feel less like I'm not doing the things that I should be doing for my kid, or that I did something to, because you know how we can get caught in that trap. Like, I did something to cause this kind of thing. So I appreciate you sharing that.
Yeah, absolutely.
All right, then. Well, if you would like to check out any of our previous episodes, please do, because we've been doing this for like 3 years now and we love it. And there's no stopping in sight. So hop on over to our YouTube channel. It is at Mom Nation USA. That is our handle. If you prefer to listen to us rather than watch on your favorite podcast platform, do a quick search for Mom Nation Talk Radio. There you will find us. Like, download, notify, all the things. Did I tell you? And audience members, you can hear this too. I am speaking to Laura, but you can hear this too. So we have our own like podcast thing now. You know how we were talking about that for quite some time, because we have several shows that we run through Mom Nation. Well, we have a mental wealth podcast through YouTube that somebody can link to. They can share if they would like. So it's, it works similar to the playlist, but it is an actual podcast. So I thought that was exciting news.
That is exciting news. I love that. And I love sharing the playlist. Like, it's so great to have all of them right there in there, just run through, do a little mental wealth marathon.
Yep, totally agree. And we've got some little clips and things in there of all of your nuggets of inspiration and wisdom. So I quite like it myself. So ladies and gents, hop on over there, take a look, and we will see you next month when Laura has all adults in her household.
Thank you.
Bye.
Bye.